Michael David. I'm a student at United States University, MSN 572, and I'm here to demonstrate to you the musculoskeletal examination. And with me here is Mr. David, who is going to perform the examination with me. And before we start with the examination, I'd like to get full consent first. So, Mr. David, are you giving me full consent and doing this under video?
Yes, you have my consent.
And you're 18 years of age?
Yes.
Thank you very much. We can get started now, but first we should need to disinfect our hands by hand washing or using a hand sanitizer. So I'm going to disinfect my hands first. Okay. And now we can get started. The first thing we do is inspect the patient's hands. If you can just spread out your hands like this, you put it on the head, just relax it like that. We're going to first inspect the hands and see if there's any problems with deformities, if there's any rigidity, if there's any atrophy, if there's any swelling, or if both of them are symmetrical. And it appears that both hands are good. Also, the color is good. There's no sign of cyanosis. I don't see any sign of clubbing on the fingernails too. So what we're going to do next is we're going to palpate each hand and fingers and see if there's any other problems as well. So we're going to start with the right hand first. So we're going to palpate your hands and palpate each digit, especially the distal interphalangeal digits, because these can become swollen and cause osteoarthritis. So far there's nothing there. Everything seems to be good. Let's have your arm, please. Okay, so each phalange appears to be normal, and the metatarsals are also, and the palm is also good. I didn't feel any swelling. I didn't feel any nodules or any asymmetry in the hand. So next we can now go and check for range of motion on each hand. Actually, we're going to do them both. So if you can, just lift your hands up and make a fist on both hands, please. Very good. And now can you open and close your hands, please? Very good. Do it again, please. Thank you. Okay, so the flexion on the fingers on both hands appear to be good, and there's no pain or tenderness felt. So we're going to do against the. What we're going to do next is going to do. We're going to swing the arms. We're going to move on to the next part, which is going to be the wrists. So like the hands, we are going to inspect each wrist. So far, the wrists don't have any deformities in them. No signs of rigidity or atrophy or ankylosis. I didn't see any kind of swelling as well. The skin around the wrist appears to be okay with no lesions or anything, and both are symmetrical. Now we're gonna palpate each wrist and see if there's anything, any abnormalities there. So we'll start with the right wrist. Okay, any tenderness there? Nope. Wrist. Okay. So both wrists appear to be symmetrical, normal, and no abnormalities noted. I didn't feel any nodules at all. I also felt the pulse as I was actually feeling the wrist. So now we can proceed now to range of motion. So what we're going to do is we're going to ask the patient to do a praying position. So can you do a praying position for me, please? There you go. Is there any pain there or anything? No. Nothing at all. Okay. Can you do the exact opposite by using the other palms? Very good. Okay, any pain there too?
No.
Very good. So can you put your hands forwards, please, and try to swing them left and right? Okay. So it appears that the range of motion on both hands and both wrists appear to be good. There's no signs of rigidity on both of them. There's no pain upon movement. There was no effort done. Everything seems to be fine. So next we're gonna check now is inspect is the elbow part. So we're gonna inspect each elbow. So the elbow appears to be in good condition. Both elbows are in good condition. I'm sorry. There's no signs of deformities, signs of rigidity, or any ankylosis or any signs of atrophy. There's also no swelling noted. The skin around it appears to be clean, no lesions, no scarring, and there's no swelling as well. So now we're going to palpate each elbow and check for any problems there. While palpating each elbow, you can also try to feel the lymph nodes, which is going to be epitrochlear part of the elbow. And also, you can also feel for signs of tenderness on each elbow, because there could be, there is such thing as a golfer's elbow, in which this part of the elbow here is going to be in pain. It's going to be experienced most by golfers. And also with tennis, people who play tennis also experience a lot of pain, usually on this part of the elbow, which we call the tennis elbow. And so far, everything seems to be intact, and he didn't feel any pain. And now we can check our other elbow as well. Okay, no tennis elbow pain over there. Okay, very good. So both elbows appear to be fine. We didn't see any sort of swelling or any deformities or any nodules at all. So the next we can do now is check for range of motion, and it's just simple flexing and extending. So with both arms, can you please stretch them out and then flex them back? Very good, very good. Okay, did you feel any pain in that one?
No.
No, okay. So when it comes to range of motion, he's able to do both arms with very, very minimal effort or no effort at all. There was no pain or tenderness felt, so it appears that everything was doing fine. So the next one we're going to do is shoulders. First, we're going to inspect, of course, the shoulders first. So I'm going to roll your sleeves up so we can actually check on each shoulder. Right. I'm going to roll the other arm as well. So each shoulder appears to be very good. I don't see any signs of swelling, rigidity, atrophy, or swelling, and both of it are symmetrical. Sorry about that. Okay, and I don't see also any problems with the skin around it. There's no scarring or lesions or anything like that. So the next we can do now is to palpate the shoulders and see if there's any abnormalities there, and see if there's any fluid or any swelling or any enlargement. Okay, so we'll start with right shoulder first. I'm sorry, and check for the acromioclavicular area, the joint, the socket area, the biceps groove, and also the subdeltoid bursa. Any pain there?
No.
Okay, good. Now we're going to test the other shoulder. Do the same thing. Okay. Same area, the bursa, the acromioclavicular area. Okay. Right. Did you feel any pain when I did that?
No.
Okay, good. So upon palpation, there's nothing wrong with the shoulders. He didn't feel any tenderness or pain. I didn't feel anything swollen or enlarged. He has the axillary lymph nodes there too, but he didn't feel enlarged as well. So the next we can do now is check for range of motion. So with range of motion, what we're going to do is I'm going to ask you to lift your arms sideways. No, stretch your arm first. Stretch your arm. Lift your arm sideways. That's it. Up like that. Okay. And then back. Up and back. Okay. Very good. On your own. Okay, very good. So that's a good abduction and flexion and extension of the arm. Now I want you to stretch your arm again on the side, and then bring it towards your middle. Towards your middle. Very good. Okay. All right. Okay. There's good abduction and adduction of shoulders on this arm. So I want you to do the same thing for the other arm, please. Okay. Very good. Very good. And then up and then towards your middle. Very good. Very good. Okay. So as you can see, the shoulders have good range of motion. Adduction is fine, and everything seems to be in good condition. For now, we're going to do a test to make sure there's no problems with the rotator cuff. So can you stand up for me, please, for a moment? Okay. And I want you to extend this right arm on your side, extend it all the way, and then try to twist it like you're emptying a bottle. Okay, very good. So that's good. Put it down. And do the same thing for the other arm, please. Okay, you feel any pain in there?
No.
Good. So have a seat now, please. So he passed the test. So far, with the empty can test, we checked for any problems with the rotator cuff. But so far, he didn't have any pain at all. So everything seems to be fine. So I guess we can move on to the next one. So the next inspection we're going to do is the neck area. We're going to check the area of the neck and see if there's any problems there, if there's any swelling, if there's any rigidity, any atrophy, any signs of swelling and symmetry. Also, apart from the neck, you also check the jaw area, which is going to be the TMJ area. We're going to check that one as well too. The jaw line appears to be also symmetrical. So we're going to check now. Now we're going to palpate each part. So it's so to check for any signs of enlargement or swelling or anything. So we're going to check first is the TMJ. So I'm going to put, we can turn on the other side over here. There you go. And then I'm going to put my 3 fingers on the side near the tragus of the ear and feel there. And while you're already there, you might as well feel the preauricular lymph nodes and see if there's any swelling. So far I don't feel any swelling at all. So I'm going to ask the patient also to open and close his mouth. Very good. And then move your jaw side to side. Very good. So the muscles on his jaw and they're intact. They're strong. There seems to be a good muscle tone. I didn't see any problems there. Rate of +5 when it comes to strength. So we're good with the TMJ. And now we're going to test also the sternocleidomastoid and see if there's any problems there. So I'm going to have to move forward like this. I'm going to feel your sternocleidomastoid area. Any problems? You feel any pain there?
No.
Right, no pain there. Also, while you're doing this, you might as well check for the lymph nodes as well, which is the pre-cervical, which is on this part, post-cervical, which is on the back part, and occipital part as well. Also, you can check also the clavicular parts over here. And so far, none of the nodes are swollen, so everything is fine. So the sternocleidomastoid appears to be in good tone. There's there's good muscle tone in there. I didn't feel any swelling. I didn't feel any nodules. And now we're going to check for the trapezius muscle, which is going to be on the shoulder area here. I'm going to feel that. There we go. And so far, there's good muscle tone. I don't feel any nodules at all. Very good. And then we're going to check also the rhomboid part of the trapezius at the back, which shapes like a triangle. So I'm going to check that, see if there's any nodules in there. Right? And there's no nodules in there either. Everything seems to be fine when it comes to a palpation. Everything seems to be good. So next we're going to do now is we're going to check for range of motion. So we're going to do range of motions on the neck by doing side-to-side motion. So if you look on your left and right for me, please. Very good. And then touch the chin on your chest, please. Very good. Then look up. Very good. And then you try to touch your left ear to your left shoulder. Right ear to right shoulder. Very good. So the range of motion is very good. He's very flexible. There's good muscle tone. There's no pain whatsoever with the range of motion. So everything is fine. So we're going to proceed next to the next part, which is going to be the spinal area. But before we do the spinal area, we're going to test first the neck for compression test, which is called the Sperling test. So what you're going to do is I'm going to twist your head a little bit on your left, a little bit like that. I'm going to push down and tell me if there's any pain, okay? You feel that?
No.
Any pain?
No.
Good. So that's the Sperling test. We tested that for spinal compression or cervical compression. But a word of caution, this thing can be used well, can be used well. We don't advise to use this kind of test to the elderly because their spines are a bit more brittle compared to the younger people. So with that said, we will now move on to the spine. So this time, I'm going to ask the patient if you can lift your shirt up and then stand with your back behind the camera, please. Thank you. Just leave it there. Thank you very much. And back and behind the camera. Thank you very much. As you can see, we're going to inspect the back and check for any problems with the curvature of the spine. Check for the height of the height of the shoulders, if they're symmetrical. So far, none of the shoulders is leaning more or higher than the other one. The iliac area seems to be aligned. The back portion seems to be in good condition. The skin has no problem. There is no deformities noted, and there's no lumps, nodules, or rashes noted over there. And so next we're going to inspect and we're going to palpate the spine itself and see if there's any problem there. So I'm going to run my fingers down the spine. So there's not any problem there. Okay, the back appears to be in good shape. I don't feel any nodules at all. Okay, and then I'm going to ask you to bend forward a bit, please. I'll bend it a little bit more. Okay, as you can see, the back is kind of straight. It doesn't curve like in scoliosis. There's no lateral curvation of the spine, and yeah, and he's good. So we're going to lean forward again, please. There we go. So as you can see, everything seems to be fine with the back, and now we can do some test. We're going to do a testing for the back. We're going to do some range of motion test. I'm sorry. We'll do that by doing a torso twist. So we're going to, I want you to, if you can actually twist your torso towards me for now, and the other way, please. Very good. And now we're going to do some bending. So I want you to bend forward 90 degrees to touch your toes. Very good. And then I want you to lean back a bit. Very good, as far as you can. Very good. And I want you to bend side to side. Very good. Very good. So as you can see, the range of motion of the spine seems to be very good. There was no effort at all doing those range of motions. There was no pain, no rigidity, no signs of ankylosis. So yeah, now since we're over with the spine, we can now proceed to the hips. And this time I would like to ask the patient to lie down on the bed so we can do that. Let's have that, please. And while doing that, I'm going to move our dog away because our dog is in the way. Thank you very much. Right. So now we're going to test for the hips. For the hip part, I'm going to move this over here. Now for the hip part, we're going to first check for, inspect the hips for any problems, check for alignment, check for symmetry, check for any signs of swelling. Second step, there seems to be any problem. Everything seems to be doing in good shape. The iliac crests are in good condition too. So now what we're going to do is we're going to palpate the hip area and see if there's any growth there, any abnormalities or any deformities. So far this is the iliac crest over here. Do you feel any pain there? No. Okay. Right. Okay. So the iliac side is good. So everything in palpation appears to be in good shape. No pain or no tenderness noted. And now we can test for hip flexion and see if there's any if his range of motion is any good. So what I'm going to do is going to bend your knee and flex all the way down to your chest. Do that. Okay, the other one. All the way. Bit of cracking there, but it's not painful. So he was able to bend the knee without any problems at all, with no pain, no tenderness. Now we're going to do some adduction and abduction. So I'm going to do this. Put it in, put it out, put it in, put it out. Okay. So there's no problems also with abduction and adduction of the hips. So are you able to do it on your own, please, and see if you can do it on your own? Go ahead, please. Very good. And the other side. And the flexion. Bring your knee all the way towards your chest. Very good. And the other one. Very good. So we have no problems with flexion at the moment, but even though we were able to do the flexion and all the adduction and abduction, there are also some tests that are being done for hips. So one of them is the Thomas test, in which we're going to ask the patient to bend his knee all the way down to his chest for as long as he can. So I want you to bend your knee and bring your knees all the way to your chest, please, and hold it for a moment. All right, hold it. There you go. Okay. Now we're trying to see here if there's any problem with the iliopsoas muscle, and do you feel any tightness on the back of your leg or anything like that? So, well, with the Thomas test, we're checking for the iliopsoas muscle tightness. So far, his is not actually very tight. He's quite flexible because he used to be a soccer player, so he's got good flexibility. Any positive sign would show that this leg would raise up as soon as the other hip, as the knee is actually on flexed towards the chest. But as you can see, it's not raised up, so everything seems to be fine. It's not actually drooping down, so I can put it down now again. Try to do the other one, please, and see. Any problems there too? As you can see, there's also no lifting of the knee when he's bending the other knee towards the chest. Okay, thank you very much. And now we're going to do the Fabry's test, which is also known as the figure 4 test. This also checks the hip joint to see if there's any problem there. So what I'm going to do is going to put your knee up, and then I'm going to put it as a figure 4, and then we're going to push it down. We're going to push it up for any problems. There we go. Feel any problem? Is there any pain there? No. Okay, so that's good. And the other one. Push it down. And push it up. Okay, so that's the Fabry's test. She didn't have any problems at all. No pain, no tenderness. So he's been his hip joint is quite good. So now we can proceed to the next part, which is going to be the knee. As usual, like anything else, before we proceed with the knee, checking the knee, we're going to have to inspect it, check for any signs of deformity, check for any signs of rigidity or atrophy, ankylosing, or any swelling. Also check it for symmetry. And as you can see, the knees are both symmetrical. They're both in good shape. And now we can check for any problems with knee by palpating it. So I'm going to palpate both knees for any swelling, any nodules, any fluid buildup. Check also the patella and the back part. Right. So far there's nothing in that knee. Very good. Very good. Okay. So there's nothing of note that we've seen on both knees. So everything seems to be going fine with regards to palpation. No nodules or anything noted. So the next part we're going to do with the knees is we're going to test them for range of motion. So all he has to do is just flex the knee, and then down, and the other one, and down. Okay, so that's the good range of motion over there. As you can see, there's no problems, and there's no effort done doing those flexion and extension of the knees. So now we can proceed and do some tests, which regards to the knees as well. We're gonna do different tests, like for example for bow-leggedness, we're gonna check for valgus testing, and I'm gonna demonstrate now this valgus test. So with one hand on the upper ankle and one hand supporting underneath the quadriceps, you're gonna lift the leg up and try to abduct and then twist laterally. There you go. And that's how I check for valgus test. With this position, I can't do it on the other leg, so it's going to be the same thing for the other leg too. So the next testing is for the Varus test, which is for testing for knock knees. So what we're going to do is, this time it's going to be the exact opposite of the valgus test. Instead, we're going to lift the leg up, abduct the leg, and then twist it inwards for knock knees. Very good. Okay, so everything seems to be fine with the valgus and the Varus test. So the next one is going to be the McMurray's one. We're going to check the knees for any tears in the meniscus. What I'm going to do with the knee is I'm going to hold the knee by the foot, bend the knee up, and then we're going to move the knees laterally, outward and laterally as well. So to do it a little bit like that. Okay. As you can see, did you feel any pain on that one? No. Okay, there was no pain on that one as well. We're able to perform the test without any problems. And the next one we're going to check is the Lachman's test, in which we're going to check for problems with the ACL. So with the Lachman's test, I'm going to do it on the one leg as well because it's going to be difficult doing it the other leg. So what we do is we hold the back of the quads, and then also hold from behind the other leg just below the knee. Lift it up. Try to support it well, like a 20-degree, and then once that, try to give the lower leg a gentle tug, going out and twisting out. See if there's any problems there. Okay. As you can see, there's no problem there. Did you feel any pain in there?
No.
Okay. So that's a test for the ACL, and then the last test is going to be the drawers test. For this test, we're going to have to make you lie on the other side. So if you like, put your head over there. The reason being is I have to be sitting at the edge of the bed, supporting it. So I'm going to do it on this leg, but it's going to be the same for the other leg too, in case you need to be doing it. So I'm going to bend it over. I'm going to support it with my leg, my butt. And what we're going to do is we're going to put the hands behind the knee and your thumb on the knee itself. And then for the anterior drawer test, we're going to give for the anterior drawer test, you're going to give a slight pull towards you. Okay, there's a problem. Do you feel any pain there?
No.
And then for the posterior one, you're going to give it a gentle push as well. Any problem there?
No.
Okay, so everything seems to be fine. That's the test for the LCL, for any problems with LCL. And so far it has no problems. So everything seems to be good. So now we'll proceed to the next part, which is going to be the feet. So if you want to have a seat, please. Have a seat back here. Thank you. So for the feet, as usual, we're going to check both feet if there's any problem with the feet. Check for deformities, rigidity, atrophy. Excuse me, dog. Sorry about that. For any rigidity, for any signs of deformities. The color is good. There's no problem. It appears to be good color. It's not cyanotic. And now what we're going to do is going to test each feet and check each digit and see if there's any problems there as well. Okay, so let's get closer. Move your foot. Okay, thank you very much. So we're going to check each feet. Check for any problems with swelling and nodules. Check each digit, the phalanges of the digits. And also check the bottom side of the feet for Morton's neuroma, which is like a swelling in between the toes and hitting the nerve. So far there's no pain over there, right?
No.
Okay. All right. Now please, and the other foot, please. Same thing for the other foot. We're going to check the digits. We're going to check with the foot. Check for neuroma. So far there's nothing there. So the feet appears to be in good shape. We didn't have any problems there. Palpation-wise, there's no swelling, there's no deformities, and then there's no other misaligned joints. And now we're going to test for range of motion. So let me have one foot again, please. Put it on your foot. I want you to flex your foot forward and flex your feet back. Okay? And then try to curl your toes. Fan your toes. Very good. So the range of motion for this foot is actually very good. There's been no effort at all. There's no pain whatsoever. So now we can now proceed to the next foot. And you can bring your foot over here, please. Thank you. And now try to flex it forward, flex it back, curl your toes, please, and then fan them. Very good. All right. Flexion on the range of motion on both feet appears to be good. Appears to be there's no problem whatsoever. There's minimal effort and range of motion. So now we can check now is the ankles. Can you have the one leg, please? Ankles. Very good. So the ankles appear to be in good condition. There seem to be no problems. Let's go to the sideways over here, please. Thank you. There's no sense of deformity or swelling, and there appears to be the malleolus appears to be symmetrical with the other side. I don't see any sign of any bony problems in there. So now we're going to check and see if there's any problems as well. So I don't feel any problems in the malleolus, and the Achilles part is also quite firm with no problems. Is it painful?
No.
Okay. All right. So there's no problem there. I'll check for the other one. As you can see, I didn't feel anything also in this part. The malleolus is also symmetrical to the other side. The Achilles part is also feeling really good, with no problems whatsoever. Okay. And now we're going to test for range of motion. So I want you to, again, flex your foot back and forth. Very good. And try to do this side to side. Very good. Okay, now the other one. Okay, try to flex it forward, flex it back, side to side. Very good. Okay, now for the last part, I want you to stand up, please. Now we're going to check your feet for flat feet, for plantar fasciitis. So if you can turn on your side, I'm going to check the arch. As you can see, he's got quite a good arch over there. There's no plainness or anything like that. And there's no pain also when you walk, right?
No.
So he doesn't suffer any from plantar fasciitis. And try to see if you can walk over this way and that way. Okay, that way. Very good. Okay, so his gait is actually good. There's no imbalance there, which means that his feet, his legs, and his hips are in good shape. So I guess we've got everything covered. So have a seat, please. So I guess we're all done with that. We've got everything covered. Everything seems to be fine with my patient over here. Everything seems to be well. He's 100% in good condition. So thank you very much for watching, and thank you very much for having me. Bye.